Welcome to DCA TV. I am Jennifer Erickson, your host for today's show. Today we will be speaking with Dr. Mark Cruz, a dentist in Dana Point, California. Dr. Mark Cruz has been practicing dentistry in Orange County for 30 years. With over 5,000 hours of continuing education, Dr. Cruz is dedicated to advancing the dental profession through a focus on wellness model of care, evidence-based approaches, and clinical expertise supported by ongoing education and research. Dr. Cruz is a sought-after lecturer who has presented lectures and clinical presentations across the country and in Mexico, Canada, and Italy. Dr. Cruz is committed to taking a multidisciplinary approach toward airway problems such as sleep disorder breathing. He is co-founder of the Airway Focused Mini Dentistry Residency, educating doctors on the West and East Coasts about the relationship between the structure and function of the human airway and facial development. Welcome to DCA TV. Today we will be talking to Dr. Mark Cruz, and our topic is on the TMJ. So welcome, Dr. Cruz.
Thank you.
First question, what does TMJ stand for?
Well, TMJ stands for temporomandibular joint. It's just the name of an anatomic structure, a joint. It's like saying the hip or the elbow. So it's the name of a joint. Temporomandibular joint.
What is TMJ disorder, or often known as
Well, temporomandibular disorders is a general term for many different disorders that involve the muscles, ligaments, discs, the discs of the temporomandibular joints and the actual joints themselves, the bones that come together to function. So in general, the rough classifications of disorders either fall under muscular disorder or myofascial disorders or actual joint disorders.
What are the most common symptoms of this disorder?
Typically, it's usually about 80% of the symptoms associated, roughly associated with temporomandibular dysfunction, have to do with the muscle function. So you have the headaches and muscle aches and soreness. Sometimes, there's that clicking and popping, but it's typically mostly associated with those headaches and muscle soreness.
What are the main causes of?
Well, the main cause is really, the way I like to talk about it, is it's a compensation in a system that's not working properly. The system's trying to work properly, and the symptoms and the signs are just a manifestation of the loss of competence that is trying to work, and it results in these signs and symptoms that I just described. And so we're realizing more and more now that one of the big risk factors has to do with how we breathe, our airway function, and that the big risk factor for that has to do with the way our faces grow. So it has to do with the skull, the face, and the lower jaw, and how they all grow together and function together.
How can a dentist diagnose?
Well, there are any of a number of ways. Certainly a history and physical is very important. Muscle palpation. There's certain imaging modalities like magnetic resonance imaging or MRI, CBCT, which is cone beam tomography, and then there's tomograms, there are lateral cephalographs. There are different ways making these assessments. Dopplers.
Now that we understand how it's diagnosed, what treatments are?
Well, the treatment really depends on what the diagnosis is. When in doubt, diagnose. So when you have a diagnosis, if it's a muscle problem, oftentimes it may be as simple as addressing the immediate acute pain with the muscles, and then it becomes self-limiting, meaning it just resolves on its own. If it's If it's related to night grinding or daytime clenching, then those issues need to be addressed. And so it's rather complicated. It really comes down to what the findings are for that individual.
Is this disorder common?
It's more common with specific skeletal makeups, if you will. A better way of saying it is it's not uncommon.
Are there any habits that make facial pain worse? There are?
Sure, any kind of posturing, repetitive motion, bad habits with popping your joints and all that, those things are not advisable. But again, it comes down to how well is the system functioning. If you have a system that is where the structures are optimal and the function is optimal, it takes much more to push the system before it becomes symptomatic in comparison to a system that the structure is less than optimal and the function is less than optimal. The immunity to a challenge is much less. So it really kind of comes down to how optimal that structure and function is with the temporomandibular structures.
Are there particular things I can do that would help relieve any facial pain?
Well, certainly when a patient comes in with the classic common condition like myofascial pain disorder, this is very common, fancy term for saying muscle aches and pains. I'll always recommend what's called palliation, meaning making it better. I'll suggest to the patient, refrain from a lot of speaking and chewing hard foods, be on a soft diet, warm, moist heat, not to be confused with a warm compress. It's actually warm, moist heat, non-steroidal anti-inflammatory like ibuprofen for 3 or 4 days. There are certain different types of things that like what's called an aqualizer, where it's an appliance that's worn between the teeth so the teeth don't touch and allows the muscles to relax. These are things that can be done that pretty quickly diminish those particular symptoms. But always, in my estimation, I always like to look at what the underlying cause is. But we must address the signs and the symptoms. But I don't like to just treat signs and symptoms. I like to treat the underlying cause.
What else can I do to help reduce muscle tension, ease my pain? Anything else?
Well, I think, again, going to a trained dentist to get a proper diagnosis and getting the advice. There's so many different combinations of problems that that's the best generic answer I can give you.
Why do I get symptoms in my ear if I have to?
Well, the joint itself, right behind the joint itself, is the external acoustic meatus. It's a fancy word for, the structure where your inner and middle ear are, and you can have disturbances in the middle and inner ear associated with temporomandibular dysfunction. So those structures are adjacent to that. So yeah, it could affect that.
What has snoring or obstructive sleep apnea had to do with TMJ?
It's a major risk factor. More and more it's being recognized, really coming out of sleep medicine literature and influencing what we do in dentistry, that we see that as a major risk factor for temporomandibular disorder. So consequently, in order to address temporomandibular joint dysfunction, it's a red flag for screening that individual for having sleep disorder breathing. Obstructive sleep apnea being just one of those symptoms.
You mentioned many treatments earlier. Is surgery often a treatment for?
It's not the first line treatment. You always want to be the least invasive and most reversible in your treatments as is possible. First, render as accurate a diagnosis or a differential diagnosis, so you've got a number of different possibilities, and you systematically go through those possibilities, being as conservative as possible, and allow the patient to heal themselves. The body wants to heal itself, and you just have to provide that environment. If you're very invasive, then sometimes you make irreversible you cause irreversible damage. So, but there are indications for surgery in certain situations. It depends on how serious the condition is.
Understand. Well, thank you so much. What a great overview on TMJ, TMD. Is there anything further you would like to add?
I guess probably the most recent thinking is that if somebody has temporomandibular dysfunction, I've treated this condition for the better part of the 30 years in my practice. I now understand more than ever that the major risk factor has to do with the individual's airway function or dysfunction, specifically sleep disordered breathing. So when somebody presents with that condition, that's one of the first things that we actually look at. And oftentimes we find out that temporomandibular dysfunction is just a symptom of a bigger problem. And so, and that's pretty recent, the recent development. So I thought I'd just end with that. Thank you for the interview.
Thank you. Thank you for being on DCA TV.
It's my pleasure.